Hello friends, good morning, good evening, namaste. Welcome to the 6th lecture in the orientation series, which is, as I mentioned earlier, is intended for patients who want to get consultation at our place and who are expecting to address their end stage diseases. Having talked about how a disease occurs, what type of doshas could lead to which diseases, how do you address the doshas, and how do you personalize your herbal supplement regimen and dietary regimen, I would want to talk about the exercises that are important. See, people think that you're doing yogasanas and you should be healthy. Not always, friends. There are several yogasanas have caused several side effects in individuals. So why would they cause? Very simple reason. Say, for example, if you're talking about lumbar spondylosis, if you don't detect the lumbar spondylosis, of course, lumbar spondylosis could occur either because of a vata aggravation in the asti dhatu, or a pitta aggravation, or a kapha aggravation in the asti dhatu. When a certain combination of VPK imbalances in different tissues leads to lumbar spondylosis, naturally forward bending exercises will be contraindicated to you. Similarly, several studies have been published that Shirshasana has caused irreversible tetraplegia in individuals because of the compression of the spinal cord at the cervical root. So friends, not all exercises are indicated for everyone. Some are even contraindicated. I'm talking about the yogasanas. So friends, you're based on your VPK fingerprint. At our organization, we give you specific warming up exercises, specific exercises for your different limbs, and specific exercises for for your ailments. So we give a specific exercise regimen depending on the VPK fingerprint. Point number one. And we give more emphasis on stretching of the of your body, friends. Which is an essential part of the yogasanas. Okay, by the way, yoga is not just for your flexibility of the body. No, yoga chitta vritti nirodhaha is what is said in the Patanjali Yoga Sutras in the chapter 1, second aphorism. So what it means is yoga is actually for attaining nirvikalpa or savikalpa samadhi by erasing your chitta vrittis or deep-seated impressions. So that is the purpose of yoga. Yoga's purpose is not being able to breathe without oxygen or being extremely flexible. No. So the purpose of yoga sama uchite, is what Lord Krishna mentioned in the Bhagavad Gita. So what is sama? Yoga sama uchite means the yoga is actually meant for bringing about a balance. Sama is for balance. So what is balance is, according to Ayurveda, samadoshaha, samagnishta, samadhatu malakriya. So the first essential component of sama is samadosha. The three doshas should be balanced. Then the dhatus should be balanced with all of these three doshas, and then the agnis should be in a certain balance. So friends, to achieve this balance is the prime purpose of yoga and not flexibility. Of course, flexibility is an ancillary benefit, of course, and that's not the prime purpose. So for this to happen, we need to identify your vata pitta kapha fingerprint. Accordingly, as I said, we give you personalized yoga regimen as well. In the yoga regimen, an important research that was done by us is that when you essentially stretch, yoga essentially refers to not just this, as I said, not just the physical component, but the physical component involves stretching up of your muscles. So what happens when you stretch your muscles? We did certain experiments. In experimental animals, what we found was when you stretch the muscles, the stretch receptors get activated. Once they get activated, they trigger a certain process called ischemic preconditioning. And what happens is the body gets adapted to low oxygen concentrations. We all know when you're under stress or duress, your alpha receptors get activated, isn't it? Agonized, and then they constrict the peripheral blood vessels. When your peripheral blood vessels are constricted, you end up with increase in blood pressure, increase in it could lead to a Raynaud's phenomenon or several other conditions that could happen because of the stress. And another an important problem of constriction of the peripheral vessels is that the end organs are actually not getting enough oxygen. So under low oxygen, when you trigger ischemic preconditioning, even under low oxygen concentrations of blood, your organs perform effectively. And we did our experiments and we demonstrated how even at 15% of oxygen concentration in the blood, rats which were induced through stretching of their femoral muscles, we were able to demonstrate normal behavior of the rats even at 15% of oxygen concentration. So that's how your yoga stretches will help you, friends. Number one. Number two is the breathing exercises. The breathing exercises, again, see, according to Ayurveda, the left nostril deals with the Chandra Nadi, the right nostril deals with the Surya Nadi, and then the interface between them where the Surya and Chandra Nadi interface is called the Sushumna Nadi. So when you do the Nadi Shodhana, you're essentially balancing the Surya and the Chandra Nadi. That's what is meant to be. But translating it into the language of allopathy, what we figured out was that when people breathe in through their left nostril, breathing and breathe out, they're actually impacting the parasympathetic system, and the right nostril deals with the sympathetic system. So in case of, say, if there is excessive vata in the brain, for example, and you are essentially impacting or aggravating the sympathetic nervous system, that's when you need to increase the impact of the Chandra Nadi or the parasympathetic activity by a certain breathing technique, and decrease the impact of the sympathetic nervous system by a certain breathing technique, which is scientifically documented now. So what we usually prescribe is a specific pranayamas for specific individuals. Usually we give something called as a differential nostril breathing, in which you breathe in through the left nostril and hold the breath for a while, and then breathe out through the right nostril. And this is what generally most of our patients are prescribed, because most of them have either vata or a pitta, or a mixed of vata and pitta dosha predominance, and both of these actually increase oxidative stress, leading to increase in the sympathetic nervous system, the activity of the sympathetic nervous system. And to decrease that, we give this breathing into the left nostril, holding your breath, and breathing out through the right nostril in a 1:4:2 proportion, which will be taught again, by our personalized yoga masters. So you will be assigned a yoga master for, teaching you the yogasanas that you would only be able to do, and which are good for you. And also the breathing exercises are customized. Many a times, many patients keep coming as, we check their nadi and we find pitta aggravation, and when we do a questionnaire survey, we get to know that these people are actually practicing Bhastrika. While Bhastrika is a good practice, it is not good for people who already have aggravated pitta, because Bhastrika is going to aggravate your pitta. Alright, so not every pranayama technique is good for everyone. It has to be customized. So what the true yogis do is, they don't prescribe you a random schedule of yogasanas and pranayama techniques. No, they give you personalized yoga and yogasana regimen, and also pranayama or a breathing technique. Okay, by the way, breathing is not synonymous to pranayama, friends. So this is another big topic that I'm not going to start now, because that's a huge topic. So just it suffices to say that your breathing techniques and personalized yoga asana techniques, and also the physical fitness regimen. If someone loves, say, sir, I don't want to do yoga, or for various reasons I want to do physical activity, physical exercises in a gym, we give you those personalized physical exercise regimen as well. So the dietary, the physical exercises, the breathing techniques, and another important component is what is happening is that you should understand is happening in your body. What is happening in your body is, by giving you appropriate diet, appropriate physical exercises, appropriate breathing exercises, and appropriate herbal supplements, we're actually bringing about a balance of the doshas in the individual organs. So what does it do when something gets balanced? What is imbalance is you have either excess of V or P or K, isn't it? Vata or Pitta or Kapha. So what happens when you give the Vata balancing therapy? You're not neutralizing the Vata toxins. You're actually, the body is eliminating those excessive of Vata toxins or Pitta or Kapha toxins in the individual organs. So what do you have to do? They will automatically find their way from the dhatus or tissues and organs into the blood. All right, this is when you would actually not suffer or experience certain symptoms of the past. So why is that happening? Is because when you have given the VPK balancing diet or herbal supplements or exercises or breathing techniques, the body is purging these toxins into the blood, and that's where you need to take certain home remedies that we prescribe. Again, it's a part of a treatment. We prescribe certain soups. They could be rice soup or barley or jowar or ragi or millet soup, or your fennel tea, because in a certain combination, in a certain you'll be given recipes of how to prepare these soups that suit you at that particular point of time. What happens if you don't take these soups is that these toxins or these excesses of vata or pitta or kapha from different organs go back to the blood, and from there they have to find their route out from the body, either through the excretory system or the hepatic system, the liver and the gastrointestinal tract. And if they don't find, they'll actually either get displaced to other organs, or they could actually put a toxic load on your kidneys or the liver. So you have to be very, very careful when you take these supplements, when you follow these polyscientific Ayurvedic remedies. You have to sign up to take these soups appropriately, every day. The quantity will be defined to you or prescribed to you at the time of the consultation. And then application of oils. This is something called as a parenteral nutrition. There's certain specific Nutex, that's the name that we give to these oils. These Nutex oils have to be applied all over your body. These are set of oils that eliminate, number one, or bind to the toxins in the blood, because from the skin oils automatically get absorbed into the body, and when they get absorbed into the body, they go into the tissues, muscle, skin, fat tissue, and or they get into the blood as well, right? There they bind to the toxins, number one. Those toxins that cannot be eliminated will be bound to these oils, or the toxins get bound to the oils, and then oil mobilizes these toxins into the bloodstream, and they have to be eliminated to the liver route. So again, this application of oils or massages or certain panchakarma techniques are essential components of our treatment process. Panchakarma is again a beautiful detoxification process that is explained in Ayurveda. Panchakarma means there are 5 actions of detoxification. These are categorized as a shodhana. Shodhana means cleansing. So it's cleansing of toxins is detoxification process. So these 5 techniques are the Vamana, the vomiting therapy, the Virechana, the purgation therapy, the Basti or the enema therapy, Rakta Mokshana, the bloodletting therapy, Nashya, the process of inhalation of certain fumes of certain herbs, or putting in oils in the nostrils or in the ears, that would cleanse those respective pathways, friends. So these are the important aspects of our treatment, and I urge that if you are able to follow all of these things, then you will see the benefit. In our organization, we almost don't use any of our other herbal or allopathic drugs. We do prescribe allopathic drugs depending on the need. Certain vitamins, certain supplements, certain minerals are prescribed, but most of them we prefer to give in the natural forms, in a natural form that is acceptable to you by your body based on your VPK fingerprint at that particular point of time, which is called as a Vikriti. So this is what I wanted to share with you today. Thank you very much.